Welcome to another edition of the eSpot with Camille. The eSpot is your location for the latest in entertainment, beauty, and design from the people who make it. Thanks for joining.
And she's back. I'm so excited to start back the eSpot with Camille season 5. And this season, much like the last seasons, you're going to be in for a treat. And I cannot wait for you to meet my next guest. We're going to talk about all my favorite topics: beauty, med spas, makeup. Just, I'm going to tell you now, if you're not a makeup lover or you're not interested in finding out more about the different treatments out there for you for anti-aging, acne, you name it. If you have a skin condition or have something that you want to change about your face, I have the perfect woman. She is from Boyd Plastic Surgery, Boyd Beauty, excuse me, a plastic surgery up in Detroit, Michigan. I cannot wait for you to meet her. Actually, they have a few locations, so I'm going to let her talk a little bit more about Boyd Beauty, her rise into the beauty industry and spa industry and aesthetics industry. Miss Brittany Traylor, I am so excited to have you. Thank you so much for being my guest.
Thank you for having me. It's a podcast dream.
My pleasure. Living my best life doing this job. So I really appreciate having you here. And I want to know, and I want to make sure the audience knows how you got your start and how much did it live up to the hype that you were hoping for when you first started, and now that you're like really into it? Yeah. Go ahead and share that for us.
Yeah. Well, thank you for the introduction. Thank you for having me. I got my start in med spa plastic surgery about 4.5 years ago. Prior to that, I worked for MAC for 7 years. So I am a girl that loves all the beauty things. So treatments, makeup, hair, the whole 9, nails. I think we're a lot alike in that aspect. And I started with Boyd back in June of 2018, and really didn't have any idea of what I was getting myself into. I was a patient of his first, and we just had a mutual friend, and we were talking back and forth, and it was, hey, do you want to manage my med spa? I was like, well, I manage 12 people now in a makeup store. I think I can figure it out. So fast forward, 2 weeks later, I have put in. I'm sorry.
Yeah, I was gonna say, managing a MAC store retail during all the things that you guys get, because full disclosure, I worked at the MAC store for like a year.
Yes.
So yeah, no, don't underestimate that. That's a lot of work. Keeping up with those constant new changes, new makeup, new look, new themes, new rules, regulations. So yeah.
Yep. And we had just opened a new store in Somerset. Our team went from 6 to 12 in 2 weeks. So there was a lot going on. One of my favorite jobs on the planet. But when I met Dr. Boyd, I felt like this was the next step. And it was kind of the step that I was venturing into slowly personally, as far as with beauty treatments and some little secret things we'll talk about later. And it was just the perfect fit. So, like any other job, the first year you're like, what am I doing? Did I make the right decision? And 4.5 years later, I'm like, this was the perfect decision. This is what I was meant to do.
I love when people say that, because for you, it was a matter of just opportunity meeting you right at the right point where you were ready to take on a new challenge, something you weren't necessarily looking for. Absolutely. But now you're in love with it and you're enjoying it. I love when that happens, because I was working at the MAC counter when somebody mentioned they were an esthetician. I was like, huh? What's that? And what do you do? How do you like it? And then that's how I got into esthetician school.
Wow. See, you're like, I would have never picked this for myself.
I mean, it makes sense for me because I'm like a clean freak, a neat freak. And like being able to I thought the worst part would be doing extractions, but that was one of my favorite things to do. I had zero interest in waxing at first. Loved that too. But I will say I'm much happier when I was a spa director, which I used to do back in the day. So I understand that part too. And that's a lot to undertake, especially with nurses, keeping up with all the FDA information as well. Yes. So what was that transition like for you? Like, what did you do as far as getting yourself prepared to learn how to do this job? And not to mention, you were a patient, so you kind of had that insight of knowing how a client feels coming into Boyd and maybe changing that. Like, how did you go into that? Because I wonder, was there a manager before you, or was this part of his growth was bringing you on?
Absolutely. So my location in downtown Detroit was completely new. So we have two other locations. There was no manager before me, just my practice manager. So it was a very quick transition. For me, submerging myself into the different treatments, some of the things that we were looking into, some of the testing and things that Dr. Boyd is privy to, just because he is a top doctor. Those were things that really helped me understand, one, what are we doing here? How are patients meant to feel? Also, being a patient, the customer service aspect, especially in that industry, is it can be very touchy. So, these things are deemed elective, but they are still medical and they're still important. So really understanding, why this patient is here and really building that rapport makes all of the difference, especially when you're starting a new business, because, those first 5 years are ebbs and flows, not to mention we also had COVID in the midst of that while growing our office. So it was a lot of things at once, but really getting into the treatments, trying a lot of the treatments, those were all things that definitely help you figure out what the business needs and where you can change and make an impact.
You just said my favorite thing, try new treatments. So one of the perks of working in a med spa is, especially as a spa director, you have to let the different people that are going to be employed practice on somebody first before you hire them, right? Like,
Absolutely.
why not you and your friends and family? So speaking of being family, hey cousin, tell me a little bit about what was that process like? Because I'm sure when you started working there, you were a client already, but maybe you weren't interested in all the services they offered. But then having them done, maybe you liked them. So I'm curious, what were some of the treatments that you were like, I don't need that, and then you're like, oh girl, this is what you need.
Oh, yeah. So, I'll just be very honest and candid. I met Dr. Boyd because I was looking for an under eye filler, which is also known as tear trough filler. Did all of the research you could possibly do, saw different plastics, and then decided that he was the right person for me. And
just for anybody in the audience who may not know what that means exactly, because I know, but maybe somebody doesn't know what exactly that means. So can you explain a little bit about that?
Sure. Tear trough filler is for under eyes, usually called under eye filler. Tear trough is just the correct medical term. And it helps with hollowness, puffy, or tired eyes, very anti-aging, and it's done with the hyaluronic acid filler. So HA is already found in our body. It can be injected in that tear trough, and you'll look like you took a nap for 2 years. Minimal bruising and swelling, no downtime. So very impactful.
I like those no downtime things. Well, at least I do, because I need to keep it moving. I need to be camera ready at all times.
Exactly. You can put concealer and makeup on and go to dinner right after you have treatment. So it's a fan favorite, to say the least.
Yeah. So you had it done, or you went in for a consultation.
Yep.
I'm sorry, since I cut you off, just making sure people understood. Yeah.
Yeah. So you go in, you do your consultation, you ask all the crazy questions that you should ask, and you make the decision. You can do it that day, or you can come back for it. I did mine the same day, and I was immediately hooked based on the results. And you still got 2 weeks of healing time, but it was transformative, and it also was something that was like a insecurity, and it was one of those things where this can be fixed this fast and done this well. Other people need to know about this. Injectables is always a touchy subject because some people are ready. It's something that you just don't decide to do overnight. You really want to have some care and consideration. But once I did that, I was like, okay, what's the next chemical peel? Let's read about this. A facial, what kind of facial, what's new, what's hot, and you're constantly in the know about these things, whether you're reading them on Real Self, you're talking to your friends, or just listening to patients talk about what they've tried somewhere else. So you can really run the gamut once you start tiptoeing and dip your toe. I always say a good facial and medical grade skincare is a nice place to start as well for someone who's not ready for injectables.
Right. I mean, definitely fit with your budget, but also like
Oh yeah,
your comfort level. Because it took me a while
absolutely.
to do Botox and filler because I am definitely afraid of needles. I don't like needles. I don't like anything. And it was surprising. Like I was there, like doing selfie mode, watching her do it. Like I was just so shocked how pain-free it was and
Yeah,
how it wasn't as scary as I had to put in my head.
yeah.
And unlike some people, I was one of those where I went in for Botox. She talked me into filler right then and there, and I did it right then and there.
Oh, you are brave.
I don't know. I guess I was just in one of those moods, like, you're the expert, make me pretty.
Do it. You told me I need to do it.
So many times in life, you just, when opportunity comes, you just open the door, the window.
Just do it.
I'm one of those people like, oh, let's just see what's the worst that could happen. And usually with my face, I'm like, oh my girl, this is my moneymaker. But in that case,
Yep,
let's
guilty.
see. She like, we're videotaping this, so this is going to be all on you. That's my face.
You're like, what did I sign up for? It's the moment they step out the room. You're like, what am I about to do exactly?
And I was so scared. Like I was just like quiet because I couldn't believe I was doing this and was hearing all the tape in my head of my parents always like, so your friends jump off a bridge, you're going to do it. And I would always say, well, if they're all jumping, there might be, and just see, you always had to be that kid, didn't you? Now look at you sitting in here, letting somebody put stuff in your face that you didn't know you needed. But I love it. I love the results. I had it done here and here. And I want to say that I feel like a lot of times with women of color, we're under that impression that black don't crack or brown doesn't come down, like all these different things. And the fact is, it could just be a confidence boost. It doesn't have to be a matter of you're changing your complete look. It could just enough to even feel like you can compete in today's world with ageism or sexism or colorism, whatever it may be. And so talk a little bit about that too, like how much a difference it can make in a client's life having these different things. But what treatment do you think has been the most life-changing for your customers? Like what has been that big thing that you're like, this is the one. If you can do nothing else, do this, whether it's for anti-aging, acne, body, like what would you say for all three?
Oh, good question. I agree, in the African American community, we were always told, this is not something we do. We don't need it. It's fine. It's one of those things, like you said, could be a confidence booster, could be a medical issue, could be a correction from surgery. We see that a lot. I think the number one thing that is great for anybody and everybody would be Botox. It's anti-aging. It helps with so many things. Botox was medical first, and then it was, the smoothness of the wrinkles is actually a side effect of it. So you can treat headaches, you can treat TMJ, you can treat chronic migraines, neck pain. So there's so many things, but you can also get a smooth forehead out the deal too. Just to be candid, but it's one of those treatments. I don't care if you're 20, 30, 40, 50, 60. We have patients upward of 80 that still do treatment. It's remarkable. Doesn't take a lot to see a great result.
And and I want to talk about that because you mentioned at 20 years old, and I love that on Boyd's website that he does break it down by age, or by decade, because it's like 20s, 30s, 40s, different treatments that are best for them. And I think it starts with teens, so it's when they're like acne, skin clearing, getting them started on good skincare and good skincare habits. Then for the 20-year-olds, it mentions Botox, and I think that's so important for people to understand that that's a preventive thing. But I also curious with all the other ways that people use Botox, if there's another good reason why in your 20s you would use Botox, other than obviously medical ones. But is that work lip flip? I don't know much about lip flip. Like that's one of the things I'm like, not really my issue. Hadn't really cared. But now I'm seeing it so much, and people are asking for it so much. So now I'm like, wait, is that Botox? Does it help with sweating too?
Absolutely. Botox helps with sweating wherever it's placed. It can help with sweating. So lip flips are very popular. We're starting to see more filler in lips because of volume. Lip flip, if you're in your teens and maybe 20s, a lip flip would do you justice. Helps with anti-aging. Helps if you have hereditary things, closer to the mouth. Another big thing that men and women are both doing is Botox for your underarms. So hyperhidrosis. game changer.
Really? Because I
Yeah.
had looked into Mirror Dry.
Yeah,
Have you heard of that?
I
Yeah, I had
have.
looked into that. One of my girlfriends was a seller for that, so she was like telling me about it. But like right before I was thinking of doing it, an influencer died. I think much like with a long time ago, somebody died from laser, or they said laser hair removal, but it was the the lidocaine product that they were using before the treatment
Mm-hmm.
that actually killed them. Nothing to do with the actual treatment. But
Yeah.
I felt like that, oh, that's a sign. I don't like needles. It's a bunch of needles in your armpit. And
Yeah.
like thinking about your glands and lymph nodes. And, I just started thinking too much about it. But needless to say, speaking of needles, not that that's the right word for it. But anyway, needless to say, it's another treatment for underarm sweating. So
Absolutely. It's
all the issues,
quick,
right?
it's painless. It's not administered in your actual armpit, so some people like appreciate that too. It's actually done right here in this area, and it takes
So a little
about
bit
50.
lower, closer to the bra line.
Yep, right here in the underarm.
Oh,
Sorry,
up there
maybe
in
I
the
should show it like right
arm.
here.
Okay.
Mm-hmm. And it's about 50 units per side, so it's a substantial amount, but it lasts about 6 months. So it's less painful. Mirror dry, from what I hear, is super painful, and it takes a while, and it takes a couple treatments. But Botox, it's quick, 14 days for total activation, and you're good for 6 months. So that's a nice little treatment. If you, I mean, yes, you have to keep up on it, but it's only like twice out of the year. So
Okay.
if that's an issue, that's definitely helpful.
So what about for acne clients? What is the number one product you or service you would say would be good for them?
Yeah. So acne, it just depends on what's going on. So if it's active acne, a lot of times we'll recommend different peels. We'll start with a good clean out, some medical grade product to get, that active acne to calm down. And then you're going to look at more of like your chemical peel. So we have what's called VI peel, which is safe for all skin tones. Love that peel. If you see someone that says, oh my gosh, I peeled like a snake, it's more likely it's a VI peel. And then the other hot thing that's happening now would be microneedling. So that's going to help with a multitude of things. Pore size, that's going to help with texture, that's going to help with PIH, which is post-inflammatory, from the acne scarring, or what we refer
Yeah.
to as acne scarring. And it helps with just bringing that skin back and producing more collagen. So we have traditional microneedling, and then we also have radio frequency, which has heat to it. Um, the radio frequency, it's a little spicy of a treatment. However, super tight, minimal downtime, 2 or 3 days, you're back to looking great, feeling smooth, and you're able to work out and continue with your daily activities.
So when you say 2 to 3 days downtime with
Hmm.
the RF treatment, what do you mean by that? Is it because they're red? Is it peeling? What can
Yeah,
they expect?
absolutely. So with radio frequency, you can have a few different things. You can have a little bit of peeling right after treatment. Sometimes you have a histamine response, which means it looks like little small webs on the skin. Those tend to go away within 20 to 40 minutes after treatment. So not much, but you can have like sandpaper like skin day 2 and 3, and it just feels dry. You're able to moisturize, and then usually by day 5, you're pretty good to go, and you can wear your cosmetics and redeem using your skincare.
Okay, great. Because I haven't heard about that treatment yet, and
Oh yeah,
maybe because they always use these names for things. Because I know micropin, but I
yes,
also know skin pin at first. So it took me a
yes,
while to. Oh, that's micro. I know what
that's it.
microneedling is, but I didn't. I knew it as skin pin, and then I don't. I mean, I'm assuming this isn't all therapy, but like I was thinking, oh,
Oh
is this all therapy? And then I'm like, oh no, no, it's not.
yeah, they have a lot of different names for it. I think the
Yeah.
most common, we have a treatment right now that's called BTL. Doesn't have an FDA approved name just yet. It's still in the testing phase. But we also have, which we call a total skin, or a genius, which is radio frequency too.
Nice. I used to work at this spa in West Hollywood called Kate Somerville's,
Oh.
and there was one. You know it?
No, I'm not familiar. But I
Oh,
just feel
okay.
like they would
I thought
have
you were
everything.
reacting to like, oh,
I'm
no.
just thinking they would have
Okay.
everything,
Yeah.
every
And there
laser.
was one esthetician. There was only one that was allowed to do the radio frequency machine, and she had brought it over from Japan. And this was like 14 years ago. And it was like all of our celebrity clients, they would see her for that and then get Botox out or all the other stuff as well, or come to me for their facials, as well as getting the LED lights was really popular then. And we had like this oxygen infusion and snake oil infusion, or snake, gosh, whatever
like venom.
Yes, venom, allegedly. Because your memory over years. I'm like,
That's my everyday memory.
Yeah, like, because I've been saying a lot of fairy tales since then. So I'm like, wait, did I read that or see that? Okay, but no, really, but honestly, like, there was a lot of times, and then they would go on the red carpet, act as if they've never had anything done. Oh, this is how I wake up. This is natural. This is the other. But that's a good thing, because now it's affordable for everyone to get those quick, easy turnaround. A couple of days down, you're back on the red carpet or back to your job or on Zoom, very far away from the camera if you need to
back on Zoom.
So, yeah. So what about for the 30 to 40-year-old women? What would you be, or men, excuse me, all the genders. What would you suggest for that age group, like they should start looking into?
Yeah, so definitely all of your anti-aging. So you're definitely in the phase of like, let's rebuild this collagen. We lose about a teaspoon of collagen a day. Yikes. So that is definitely, it's a whole lot. So that's why we're constantly injecting HA to kind of keep that barrier there. Chemical peels are going to be huge. Resurfacing. So like you mentioned, alt therapy, that is a great skin tightening treatment. It's a spicy treatment. However, you only need about 1 year to just maintain what's already there. And you're not looking for results right away, because it takes about 3 to 4 months with alt therapy. But that's a great investment for neck and face. You can even do your body now with alt therapy. So, kneecaps,
I
arms.
saw that on some show. They were Kelly and Ryan. Yeah, Kelly and Ryan. I'm like, and there was a doctor there that was doing it on the knees. Yes. And I knew it wasn't quite FDA approved yet, but maybe, or cleared. So maybe it was just like she was one of those top doctors that could do things before everyone else.
They call it off label.
I'm glad to know. Yeah, well, I trust doctors with off label, and I trust nurses with off label, but the regular.
I've seen miraculous things happen with off label.
And we're going to get into that. I'm just going to help with my 50 and plus group. I'm just going to say all plus, because you never know where the aging is at. And once you get past 50, because I feel like now that I'm past my 40s, so many things have shifted, and they were like, oh no, I was thinking, oh, I'm doing everything I can to look as young as I want to inside. I'm taking care of my skin, always getting facials, always doing the most, always using medical grade skincare since for 20 years now. I've been using the same brand, love them, because I have really sensitive skin and they never break me out. But, like once you hit past 50, you're definitely more confident. You definitely feel more secure in your skin, but at the same time, you might want to keep it like from looking 50 for as long as you can, or 60 or 70. And some of these 50 and 60-year-olds look 30 and 40 because they've been taking such good care of their skin. Hello, J-Lo. Hello, Gwyneth Paltrow. So saying all of that, and Angela Bassett, good Lord.
I was going to say Angela Bassett.
Like they could all pass for the same age group, So it's like, what advice would you give as far as making sure people in those age groups maintain or start preserving? Because I saw stuff about the facelift, the nose lifts, or not nose lift, the liquid nose, rhinoplasty, and like brow lift. And so share about that. That's what I want to know.
So many things. So, I mean, obviously injectables, fillers, those are a given, right? Those are things that we're replacing that collagen. But something I'm sure you probably heard of it is called a silhouette, where they use threads to lift. So as opposed to doing a mini facelift or a full facelift, so early on, they are collagen threads that can be inserted underneath the skin, and it will pull and tighten and lift, and minimal downtime, right? So you're in and out, you just can't work out for a week, but you can put makeup on.
Any excuse to not go to the gym. Thanks.
No, I'm sorry.
I'm kidding.
We have something for that too that helps. You can do in the intro.
We're getting into that because that's what I'm saving. Because
I
that's
know.
what I have the most questions about, because I find it so confusing. And I'm a little bit scared of it because of a certain Linda Evangelista story. But
Yeah.
tell me more. So you were saying about the facelift, this threads. I've heard of them
Yep.
called like sugar threads for some reason. I don't know why, or maybe I was
Yeah.
misunderstanding someone. Is that the same
No,
thing?
so people, yeah, so people call them different things. There's different brands like everything else. There's Silhouette, they call them sugar, they call them PDO threads. Some people will just say, oh, they're like a Sculptra, which is also another form of a filler. So they'll kind of compare them to that as well. But you can use those all over the face. Brows, especially, it's really nice because it's quick, it's easy, and you're in and out. You don't have to heal. You don't have to take off work. You have a little minimal
No,
swelling.
just lines.
Yeah,
You
all
don't have to
around.
shave your hair, and there's no like lines that
Nope.
show off that, or the ear
There's
thing. That extra, like you can always tell around the ears and jawline sometimes when somebody had
yeah,
a facelift that wasn't done properly, I guess. I don't know. Because
exactly.
if you can tell, then it was done wrong. But if you can't tell,
Yeah, if you can't tell or you have a wedding to go to, in a month, it's a great treatment that you can get and be ready and healed and feeling great and ready to go. You can also still do Botox and fillers while you have those, and they last about 2 years. So it's a little bit of an investment, but not as much as a facelift, which is great. Um, what is my other thing for 50 year
and you
olds?
don't have to do anesthesia and
No, no anesthesia. Nope, all local. Usually you can do a local, and then we also have what's called Pronox, which is like a laughing gas, stays in the system for 5 minutes, and you're able to drive home. So you don't need a driver, or your secret's safe with us at the office.
I love that part because I didn't. The other part is I didn't tell my husband until after I did it too. I just told him, "Oh, I got a nurse's appointment."
He's like, "What did you do?" Oh, just a facial. I think that's what I
I
did.
have a facial that requires me to wear an ice pack on my head
An ice pack
just to
all
make sure it
day.
never hurt, and it never did. But I was scared of feeling the pain later. Later because I didn't feel anything.
Sometimes you anticipate it, and sometimes you work yourself up and you're like, that's it. That's kind of how I felt about under eye filler. I was like, this was not that bad. You didn't have to have a whole anxiety attack, but here you are.
That part.
Yes.
That
Yep.
part.
So I would
So
say definitely.
okay, nothing.
Oh no, I'm sorry. Yeah. So I would
You gotta
say
say
for 50 years.
definitely something else.
I'm sorry. Go ahead.
There's a delay, I guess, because I was just like, no, you were saying about, so don't worry about it. Go right ahead. I want to hear what you were
Okay.
going to say.
Yeah. So I was just saying, age group of 50s. You definitely want to be restoring that collagen. There's ways to get around facelifts and things like that where you have minimal downtime because everyone's busy, and everyone has events and things going on. So also laser is super popular. Laser hair removal. There's now lasers for pigment like a Halo BBL. That is an actual device, not the other BBL that we're thinking, but that helps with
The airplane.
pigmentation. Yeah, we're not those.
Inside joke. Others might get it, but that's all
I'm
I'm
sure
going to say
some
about
people will. Just go on TikTok.
it. And we're going to talk about that too. I can't wait.
So many.
So, might as well just get into it now since we kind of brought it up already. Why make people wait? You know what I mean?
Why not?
But there's so many trends and things that you're seeing now on TikTok, Instagram, social media in general, and just people even promoting things that, oh, I bought it off of Amazon. Like you can buy these weird fillers off of Amazon. That's like the same kind of injectables that they use for insulin, which I'm like, why would you want that? But
No.
on the good side of things, there's also the fact that the community is sharing that this is what it's like. This is what I've had done. You can follow real, legit doctors or injectors, and they're like professionals that are sharing real information instead of going by just people who say they may know and don't. So, what are some of the things that you've seen that have just been like triggering, like, oh my God,
Yeah.
brace
So
yourselves, you're going to get phone calls for this crazy treatment that nobody should do, or that we're glad people are talking about?
yeah. So just like with anything, safety first, correct? So something that we do a ton of, unfortunately, it's called an excision. That is where silicone has been injected, whether it's in the cheeks, Fortunately, I've not seen it in the nose, but most commonly cheeks and lips. It's honestly across the board, men, women. We're seeing a ton of it in the last 2 to 3 years. It has doubled as far as seeing patients with this. It's unfortunate just because sometimes it's just lack of knowledge. Sometimes, it's price, but it's terrible for your body. Looks okay for a while, and then tons of complications. It basically looks like oil and water in the body. So the doctor would have to surgically remove that from whatever area it is. Um, that's a lot of healing, a lot of swelling. There's a lot of downtime done with excisions. And it's so hard to um, tell because it's one of those things where you have to go under for them to see what's actually in there and then getting it all out. That is something that the community is starting to talk about more and more. And we've had a lot of people from our office as influencers for it. And that's super helpful. But excisions are rough. You really want to make sure you are not getting any other filler but from a reputable doctor's office. Cannot stress that enough.
Now, see, that's the thing. Like a lot of times, whether you're at a doctor's office, a hair salon, whatever it may be, always privy to knowing what exactly they're putting in the vials or what they're putting on your head, or what's
Yes.
going on. And sometimes as customers, clients, patients, we're scared because like they're the expert. How dare I
Yes.
question them? Or how would I know the difference anyway? So I guess speak a little bit about that. Like as far as how can you tell if you're going to somewhere reputable, if they are using silicone for an area they shouldn't, like how would you know that? Like if there's any tips you can share, or even from maybe past clients who explain how they ended up with, because I hate victim blaming, because as much as we try to be educated consumers, you still don't know what the other people's intentions are, what they're doing, what they're hiding from you. I mean,
Exactly.
let's just think back to like I always bring up the Yugo, but maybe a lot of people here are too young to know about the Yugo. But I mean, Lee Iacocca or whoever owned Ford at the time, like they knew that the car was dangerous, but it was cheaper to keep it on the street than it was to recall it and
Yeah.
fix it. So there's so many times, or even if you watch the movie Dope Sick, like there's a lot of times people just don't really care
Yeah.
about the individual in front of them. They're just thinking about that dollar. So can you
Yes.
share a little bit about how you can tell the difference?
Absolutely. The biggest thing I think that people should know it would be just feel empowered to ask questions. So if you would like to see the filler box, if your injector doesn't bring the filler box in, hey, what filler is this? Why would you select this filler versus something else? Because you'll be able to see one that the syringe has whatever product that you're purchasing on there. Two, you should be able to know what's being put inside of your body. An injector should never give you pushback or make you feel bad or feel like you're a burden if you're asking, hey, what are you using and why? Um, so that's one big thing. And I
Red flag,
think
right?
red flag, yeah. And I just think it's one of those things where sometimes like we're nervous and your nerves are going and you just don't have the voice at that moment to say that. Also, do your research. Websites, calling the actual physician's office and just asking questions. That is okay. Front desk on the phone should be able to help you, make a sound decision, tell you about the doctor, where they went to school. You should be able to find all of this information too. Another little hidden gem that I think that kind of got lost in the sauce is realself.com. There's real patients that have been to real physicians that are on the site that are reputable. They're real. They perform these treatments and they have to be verified patients in order to post reviews on there. So it's just not, Kelly from wherever.
Control. Yeah.
Yeah. So it helps.
Influencers. Yeah.
Exactly. So it has to be an actual patient that has seen that doctor. And what happens is on the back end, they reach out to the offices to verify that, hey, this was a person, they left this review, and you can, say yay or nay through it, and then it gets posted. So that's a super helpful thing. Even if you're just looking around or you're thinking about going to a different state for something, it's helpful if you can't get to that office. And then obviously, word of mouth. If you had a friend that says, hey, that you trust, hey, I went to this doctor, just do a consult. You should never be forced to get treatment the same day. You can always do a consult, think about it, weigh your options, and see several doctors if you need to. Those are mine.
Yeah, I think that's great advice. You can always get a second opinion with everything else. Why not your face sometimes? Granted, there's some people you don't need a second. If you get in, you better not waste that time.
That was me.
I might not get this appointment again. I'm not. No, let's do it.
I was like,
there's no.
I was like, I'm 3 months in. Let's go.
Hello. It took me 12 years to get the courage to get this done. You better do this right now.
That's it. You like, I've been researching every night for 4 years. I have to do it now. It's now or never.
Yeah. Exactly. And I watched all those shows like Botched and different things. And I think that was part of the reason why I was kind of scared of doing anything to my face, because I was like, it would be my own fault. And this is my moneymaker for the most part.
Hey,
but
I'm with you.
Yeah. So it's like, you sure you think it'll be better? I mean, okay, it's been a while since I've had my forehead done. Like it was March, so it's not as
looks smooth to me.
As smooth as it should be, but it will be soon. Because I'm like, I noticed the difference, and I think that's one thing people don't always realize. It's not always just the wrinkles, but it's like the over emotion. Like I don't want to look like I'm that angry when I'm just being inquisitive, or having like RBF. You know, like I felt like people just always felt like I was, not always, but I would get, sometimes people thought I was stuck up or this, that, and the other. And I'm just, my face is plain, but maybe because I don't know that I'm giving them the stink eye.
Yeah, you're like, I don't mean to do that.
I don't.
You're like, I just had a question. That's all. I had a question.
Right. Or whatever. Like, y'all don't smell it too? Like, you know, it could have been something else going on in my mind, or I'm thinking about a math problem. There's so many different things, but your face doesn't give it away. It's a perfect way to have poker face, because I do wear my emotions on my face. And that's what I loved the most about Botox, is I felt like my emotions weren't as like overdone in that way. And it's even funny, even like with my husband, sometimes he would say, "Why are you looking at me like that?" Looking at you like what? Like I want to think you, you know. I thought you were mad at me. Yeah, it's just my face. Sometimes, you know, I'm not always making jokes, so sometimes my face is straight and just normal, you know. So
like, this is how who I am.
Which he does. But at the same time, I just feel like it's important for people out there to understand that, because all the time they're like, well, you're pretty, you don't need it. You know, it's not a matter of need. It's a matter of what I need to feel the best in my skin. Because just like I went to college to be my best self, you know, like I did the steps. Well, my parents forced me to go to college.
And it's just one of those things that make you feel a little bit more graceful. You know, you look smoother. You're like, I feel more confident. I think everyone experienced that over quarantine of like, I'm going to do better about taking care of myself. So think of it as self-care. I mean, you know.
Yeah, and honestly, with all of us seeing each other on camera now and Zoom, I think that was a big thing too. And I was kind of surprised how many of my friends went under the knife during the pandemic, because they're like, nobody knows what I can recover in the privacy of my home with the camera off when I have to do work. So I was like, oh my God, that's amazing. What did I think of that? So tell us a bit about how that transition worked for you guys. Like, how did you guys have to transition with the pandemic? What are you guys doing differently in that sense too now, looking forward? Because you just never know. But I feel like luxury area is one of those things. Like, there's some people that will always be able to afford it, so it's not as it's not 100% recession proof, because things happen. But at the same time,
you know, for us, our office was gearing up, and we were like in a good space, and I have another full-time injector there, so we're like, we got 2 estheticians, we got our doctor here, we got our full-time injector, and COVID was like, stop the press, and we were like, whoa. So we were closed for 2 months. Dr. Boyd was open for emergencies only. So while a facelift sounded great, he was not doing facelifts. He would do stitches and things like that were happening every day. People were hurting themselves really bad. But coming back from that, our office exploded. literally, with patients and with everyone saying, you know what, I'm taking better care of myself. I am getting on a regimen. I need to look better for life and for Zoom. And so we really saw an uptick in just fillers, Botox, chemical peels. And you would think, mostly women. However, men too. So men are just involved in this stuff as we are. They might not talk about it as much. They're doing it with their partners. They're going with their wives. They're um, learning a little bit more about it. But COVID definitely was one of those things that it was kind of a gift and a curse, because it also helped people realize, hey, I haven't been taking care of myself. This is a form of self-care, and you know, I can do this with my mom, or I can do this with my daughter or my spouse, to feel better. So it was actually really nice to see.
Oh, I love that.
Yeah.
So I want to make sure we talk about this because we talked a little bit about it off air. And, you know, with the pandemic, there was a lot of people who gained the COVID-15, the COVID-20, the COVID-100, whatever it may be. I'm not judging you guys. You guys are out there making new recipes. I was not, and still ended up towards the end really randomly, but I did have surgery and they told me that's why I gained weight all of a sudden. But I have to know about all this sculpting that's going on, whether it's M sculpt, cool sculpt, ice sculpt, sculpt. I don't know. Like
Sculpting.
everybody's sculpting, and it's not just ice sculptors anymore. So tell
Nope.
me, or artists for that matter. So can you
Absolutely.
share a little bit about the differences or why certain procedures are better for others and so on? Like why you guys use what you use, or have you tried? Because you have to try everything. So what have you tried that you're like, this was a game changer?
Yeah. So all the sculpting is happening. So yes, I was too a victim of Oreos during quarantine, um, and all of
Not
the
a
snacks.
victim. I mean, there are 160 calories per a cookie.
I'm like,
I hated the person that told me that because I was like, it's vegan. And then
me too.
you look at the calories.
I want to know the calories, and during quarantine, no calories matter in my book.
Sorry. Yeah.
But
Disclaimer, calories don't count if you're standing up while eating.
no, I like the way you think.
Okay.
So something that we use in our offices, there's mixed messages, but like with anything, do your research on your provider. Cool Sculpting is phenomenal. It's come a long way. It's been out for quite some time, but the hand pieces get better and better. Meaning you can sculpt off label, so knees, legs. The rule is if you can pinch it, you can cool sculpt it. And so what cool sculpting does is freezes the fat cells, and you pass them through urination. It's not a process that's super quick, so it takes about 3 to 4 months to see a full result. But once you do it, unless you have excessive weight gain, and I'm talking about 40 pounds or more, that area stays cool sculpted. So it's permanent. So there's usually required 2 to 3 treatments. But think about your arms, legs, the age-old midsection, your flanks or bra fat. To be able to do that and then, go on a vacation and feel confident, it's phenomenal. So it doesn't help you lose weight. I always suggest if you need to lose weight, lose whatever you want, because that'll help you reduce the amount of treatments needed. But it's awesome for like volume and just making clothes look better. My favorite, and you can do these in tandem, is M Sculpt. So M Sculpt is fat burning, and it also tones. So, need that help with that extra push of ab work, jump on M Sculpt. It's only 4 treatments, 30 minutes of treatment, no downtime. And again, takes about 3 to 4 months for a full result, but it's super quick. It's painless. It's the equivalent of doing 20,000 crunches in 30 minutes, something that we would never be able to achieve.
Not a human person.
No. So recently,
I don't think that they could even count that high while doing the push-ups at the same time.
I can barely count to 20.
I can count after, yeah.
I have to work out after this, and I barely can count to 20.
Okay. Well, here's the thing. Like, I remember Toni Braxton a few years back was saying she used to do 400 push sit-ups a day or something. And I remember trying that for a week. Girl, who's counting for you? Who's counting that entire? Because I mean, I am dyslexic. I am ADHD. Full disclosure. So I do can get easily distracted. Squirrel. You know what I mean? I am that
Yeah.
girl. But at the
Yes.
same time, I was like maybe she breaks it down like 4 times a day, 100 or something. Because this girl
Tony
couldn't get
she had to have a personal counter. It's the only way.
That's true.
I struggle getting to 20, and I'm not exaggerating. I'm like, was that 18? I don't know. I'm not sure.
Especially when you're doing sets. I'm like, do it until you can't, and then we'll just go to the next one. I can't keep up.
I can't keep up. Let's start over.
Yeah. So M-Sculpt is like toning and fat burning together, and then Full Sculpt is the freezing of the fat cells, and you can use them in tandem. How do you recommend that? Like, what do you mean by that?
Yeah, so you would, honestly, I would say start with cool sculpting. So you're freezing that fat, you're getting that out the way, and then you're following up behind it to kind of tone what's left of that area. So with M-Sculpt, you are a little bit more limited with area. So abdomen, glutes. So it doesn't burn the fat there. It actually helps to lift and tighten them. So 20,000 squats in 30 minutes. Sign me up because I hate squatting. And then they also have the new hand piece for your arm. So with the M-Sculpt Neo, they actually have it, and it does the work for you.
You can have Angela Bassett arms.
Yes, Angela Bassett does so many good things. So many.
She's my aging guru. Her and Diana Ross, because the fact that Diana Ross can still perform. Oh yeah, you're from Detroit, so you probably think of her as a queen as well.
Yes.
I live for her.
Beautiful.
Mm-hmm.
And
and I think a lot of times when celebrities are like, oh, they just had a baby, and next thing you know, they have like perfectly sculpted abs. Keyword in that is sculpted. You're gonna say they didn't get liposuction or plastic surgery, but now we know what's really happening with all those crunches they did or squats.
Yes. And it's so funny you actually mentioned pregnancy because what we found is M-Sculpt is actually helpful for ab separation. So after giving birth.
For diatus recta.
Yes. I'm glad you know the medical term. Thank you. So I could not.
That's because I have it.
And okay. So I don't have any kids yet, but we have a plethora of patients that said that it really helped to bring them back. And it's not painful. So it's not something that you have to do right away, but I mean, it just helps to kind of strengthen those muscles, something that we naturally just can't do. So
right. And the fact is, like, I was reading about diatus recta. You don't necessarily it's a lot of times people are born with it. Like they have a more protruding belly from like childhood even. Because I was always holding it in, not realizing it wasn't just my baby that made it worse, because I did get 70 pounds overweight while I was pregnant with her. But yeah, because I was like, I'm eating for two. And it was like the first time in my adult life I wasn't on a diet. So I could eat like fried food every day, and I mean, I was eating a lot of vegetables, and I gave up caffeine, so I had to find a way. And I was a smoker before I was. I had my daughter. I know, bad, but that was beauty life. That was the only way to get a break when you worked at retail. So I started because I quit, and then when I started working in retail, I was like, oh, that's how you get a break.
That's it.
I just hold it a lot of times. Yeah. Bad habits. Kids don't smoke. It's horrible. It was really hard to quit. But needless to say, so for people out there that do have maybe a more protruding stomach or can maybe you don't know that you have diatus recta, because I didn't know. They thought I had hernia at first, and then I went somewhere else to find out, and they're like, I don't know, honey. This is all. This is not connected. It's not just one place.
You're like, help me, please. What do we do?
Yeah. So again, that's why I'm loving having this ability to share this information, and I'm very transparent. So anytime anybody has any questions, feel free to reach out to me, and I'm sure they can feel the same way with you as well. But
absolutely,
before we forget, please tell me about your lip gloss line.
Yeah. So I am a product junkie in all sorts of ways. So I am obsessed with packaging, sparkly things, glitter. And so I've always wanted to have my own cosmetic line. Working at MAC, that is not a thing. But so last year, I started Obsidian Glam, which is a vegan lip gloss line, and we'll be venturing into some more things early fall this year. But we have beautiful lip products for everyone. There right now are six. I'm sorry, there's six in total. There's three mattes and then three glosses. So the mattes, they look beautiful as eyeshadows. They're safe for the eyes. They're safe for a liner. And so they're fun to layer.
Shots fired. Why do I do that? Shut up, you say everything that's on your mind. But
yeah, so they're
no, and those that don't. No.
I'm sorry.
Do you know what I'm talking about with the Huda Beauty?
Yes. Yeah.
Okay. Yeah.
Mm-hmm.
So
Yep.
that's what I was saying. Like, for those who don't know, you can look it up. I'm not getting in trouble again.
You're like, I'm not doing that. Yeah. So
I love their products, but yeah.
Yeah. So, you know, the packaging is beautiful. It's something that I wanted. I don't care if you have a Birkin bag, a Chanel bag, or your beauty supply store purse. It's a conversation piece. It's something that you can actually wear if you want to. I have some people that have like worn it as a necklace or model with it as a necklace. They're putting it everywhere. And so it's just a really pretty gloss. I have a 4-year-old goddaughter, and I'm pretty sure she has all of them, and she wears them frequently. So safe for the kids too.
Her mother is very proud, is very happy with that. At least it's something good. At least it's good product. It's her own line. She's not getting it all over the place. But allegedly. I love that. Great. It's not as bad as giving her a drum set, okay?
Perfect.
It's not battery operated anyway. But I'm going to talk about the packaging for a little bit, because that's what made me love and just like, oh, I have to get it. So I bought my own. I'm waiting for it to arrive. But the packaging, it looks like the Death Becomes Her vial. Yes. So for all of you out there, know I love Goldie Hawn. I love Meryl Streep. I love Bruce Willis. I do have pictures of him in a family photo. He stood in for my husband. He doesn't know this, of course, but
I love it.
Just saying. Yeah, I'm that girl. And so I love the packaging. I'm like pretending like I'm holding it. Like, this is nothing. But needless to say, I love the packaging. So how did you go about picking that out and figuring out? Because I'm sure that's not the easiest to design or decorate, or even, from Mac Life, putting on the shelf. So what were you thinking when you came up with that product?
Yeah, so my other favorite color in the world is gold besides black. And so I was like, I want something gold. I want something fancy. How do we make this? And after looking I'm a researcher, guys. So like I look until I'm tired of myself. And I finally came across something that was, one, easy to package, but also make sure that you didn't have spills in your purse and things like that, because you don't want to mess. And I came across this bottle and I was like, let me just see if this is real, because this is kind of too good to be true. I really, really liked it. And did the packaging, got the logo, and it just really just spoke to me. I was like, this is it. I'm done looking after 4 months. Literally took me almost 3 months. It's challenging in the way that it has to be shot in pictures and things like that. So I'm still working through those fun things as far as marketing goes. But it's beautiful. It looks great on all skin tones. If you go to the Instagram, you can see a lot of different skin tones wearing different colors and how they pair it with each other. And it's beautiful.
I can't wait. So tell me, how did you, for those people out there, because I know even I at one point was like, ooh, I'd like to start something. And then I looked into it, and then I was like, ooh, all the FDA, EPA, like all the regulations. And I'm really scared of like getting people, because I took all those business ethic classes and stuff like that, and about the Yugo guy and stuff. So I'm like, I don't, I was really scared I could mess people up, or like, end up getting sued because they put the wrong number red in my product or something. So tell me, like, what were some of the, I guess, pitfalls or challenges that you had to overcome, just for any new entrepreneur that's looking into getting the beauty industry, and not just white labeling, but actually starting your own? What about that was challenging for you?
There's so many things. Look, there's so many things.
All right, like, what's your top one thing you would share for other people to make sure and getting started?
Absolutely. I would say number one thing is just make sure you know your ingredients. Like you said, that is just one of those big things. Like, even if you are doing like a private label thing, if you take the time to Google every single one of those things and make sure it aligns, it feels good. Um, it took me about 3 or 4 batches before it was right. And so that's me wearing it. That's some of my friends. I'm like, wear this. Hope you don't break out. Let's see. Um, Before it was ready to go. And, I would say just doing your research wholeheartedly on products was safe for eyes, was safe for lips, as you know, being a former Mac girl, all those things make a difference. You put a sparkle in something and say it's eye safe, and it's not. It's an issue, and it's something that you wouldn't think is as common, but with cosmetic products is super important. So just kind of having that background, I
Around
just
your lips too.
yeah, and just research it.
You're ingesting it, even if you don't mean to intentionally,
Yes.
or you're kissing somebody else who's ingesting it. Like, you want it to be safe. You want, so it's important. And your skin's your biggest organ. What you put on it is important.
Yeah.
And we're all learning more and more about how cosmetics can be, especially in the Black community, can be overlooked in the sense, like, some relaxers they're talking about cause fibroids or this, that, and the other, or like, no, who's testing,
Absolutely.
who's making sure we're safe, and different products they were saying has asbestos, and those are made for kids. So it's just like, you really never know. And I'm glad that you're doing this. You're starting your own. And I want to, one last question, and then I want to make sure you tell everybody how they can follow you. But so many times people decide not to do something because they're like, there's already so many people doing it. But there's like 300 barbecue sauces in the grocery store. There's 2,000 different skincares or clothing. Like, how did you make that step of like, but there's not one like mine. There's not one with my pack. Like, how did you talk yourself, or even talk to the naysayers? Like, you have to do it.
Yeah. Oh, that's a good question. Back and forth every day. A lot of self-talk, and it's just one of those things that you really just have to kind of be, I guess I would say, a little crazy about it and passionate about it. It's one of those things where it's like, there are a million lip gloss lines. We have a million in our bag at any given time. But, what is it about this product? How can I make it stand out? Who is this appealing to? Everybody is not your customer. Some people don't care about packaging. Some people just want something to put on their lips. But also, there's always room for growth. There's always room for change. So just thinking about what speaks to you, and then how you can, fill a need for someone else, whether it's through a color, through a packaging, group of people. There's never enough, and there's no end in sight for all these products and things and podcasts, and there's so many opportunities for everyone.
I mean, if I knew that every celebrity, well, actually, even if I knew every celebrity had their own podcast, so what? They're not speaking from a real person's perspective who also works in the film industry, who knows what it's like on both sides. But yeah, you just got to go out there. I love that you're saying that. That's why I wanted you to say it, because you're really doing the thing, and you're got the full-time job of amazement in the beauty industry with Dr. Boyd, and then you're doing your own line as well. Like, you're definitely a superwoman. So tell everyone how they can follow you, keep up with you, and support your line. Go ahead and share all of that information too.
Yes. Well, you can always follow me at blauren629. That's my personal page. You can DM me. You can ask me questions. You can send me pictures, all of that good stuff. And then you can always follow me on Instagram. Neck up.
And be careful what you say when you say you can send me pictures.
This is true. And then you can follow me and my lip gloss line at Obsidian Glam on Instagram. It's just an underscore before and after, but as soon as you type it in, it'll come up.
Oh, fantastic. Thank you again, Brittany, for being my guest. And I have to thank Lillian Jones for introducing us. I absolutely adore her.
We love her.
Thank you again for being my guest. And thank you, Lillian, for bringing such a wonderful guest to my show, because this has been great talking with you, and I could talk to you for hours. So I'll definitely have her back.
Thank you so much for having me.
Oh, my pleasure. Look, she will be back. So if you do have any questions for Brittany and you don't get the chance to slide into her DMs, don't worry. Leave all the questions and comments or email them to me as well. And I will make sure that the next time she's on, we do a live. So you can ask those questions yourself, or I can ask for you if you send them to me ahead of time. But again, thank you, Brittany, so much for being my guest today. And thanks everyone out there for watching. Make sure you check out my website, CamilleCower.com, to find more interviews, to find more information about Brittany as well, and to get the links to follow her. And you can always check out my YouTube page as well as Facebook, Instagram, TikTok, Twitter, all the things. I'm everywhere, but I'm not necessarily posting everywhere because I do have a life. All right. Well, thanks again for joining us. Thank you again, Brittany, and thanks everyone out there for watching. I really, truly appreciate your support on another season. Bye, everybody.
Looking exquisite, no competition. Stay on the pivot. Who be watching? They be plotting. She's so motherfucking independent. Mama be big, got on her grind. She had to get out her mama house. Daddy be tripping, now she be whipping. Ain't no more.